Hello, I'm Dennis Quaid. Cancer. It's a dreaded diagnosis, but there is promising news. With early prognosis and the right treatment plan, the 5-year survival rate has dramatically improved, and new breakthroughs are emerging every day to help us fight this war on cancer.
In the war against cancer, early detection and access to quality personalized care remains crucial. Utilizing added technologies alongside advanced therapies and detection methods, this type of precision medicine looks at how a specific gene mutation may affect a patient's risk of getting certain cancers. And if cancer already exists, it can show how one's genes may affect treatment. As always, success rates hinge on a number of factors, none more critical than making quality cancer care available to all who need it by meeting patients where they are. It's one of the key reasons why some experts feel it's best to seek out a physician practice rooted in community oncology.
Community oncology is a physician-owned practice that is not under the direction of a hospital or an academic center like a university. It's important to get your care close to home in a community oncology setting for a variety of reasons. One of the most important, I think, is being close to home in the first place and having a care team that is nearby so that if you run into complications during your treatment, you have a team that knows you. You have a team that can see you quickly, get problems addressed if you have a fever, if you're dehydrated, if you're having some of the expected complications of cancer care. You want a team locally that knows what's going on and can help you right then and there.
This community-based healthcare team of specialists is working together to help bring personalized multidisciplinary cancer care directly to its patients, wherever they are throughout Iowa. Physician-owned, affable, available, and able, their goal is to offer patients and their families the benefits of a community oncology approach.
We're very fortunate that we have all of the highlights of a larger academic center, but in a community setting. So we have the ability to do chemotherapy, we have our chemotherapy infusion suites, we have on-site lab testing, we have multidisciplinary tumor boards, we have clinical trials available. So we have all of these pieces that you would normally expect to see at a larger center, but locally. We try and approach it as a whole person, where we're addressing also financial issues, not just the medical end of things, but we also want to address the financial end as well. Medicine in general has come a very long way in the last even 10 years. And so what we're finding is that treatments that we used to use for a specific type of cancer, so for example, like lung cancer, it used to always be the same treatments with chemotherapy. And what we have found over the years is that all of these individual cancers biologically behave different. And so we've been able to develop these genetic testing, genetics meaning genetics of the tumor cells, and so we've been able to find mutations that we can then target. So we've developed all of these drugs that are specific to those individual mutations, which allows us to tailor the chemotherapy or the drug therapy specifically to that patient and not just kind of a broad approach across the board with chemo in general.
Through evidence-based treatments, tumor boards, genetic counseling, and clinical trials, this carefully constructed ensemble of physicians and caregivers work to develop a personalized plan that is unique to each cancer diagnosis.
A number of studies have repeatedly shown that community cancer centers can deliver the same quality-based care as large cancer centers at a significantly reduced cost. Average is about 30%, but sometimes it's significantly greater than that. By going to local communities, we take away the barrier to care for patients. It's more cost-effective, and we leave them in an area where they have their own support system. We are able to reach the patient quicker, to expedite appointments, to expedite evaluation and reach a diagnosis and start treatment sooner, which ultimately leads to a better outcome and reduced costs. We have a large elderly population, and so it's difficult for them to travel long distances. They may not feel comfortable or confident driving into the city, so we're able to get that care to people who otherwise might not have access to that.
Gone are the days of traveling outside the state for top-tier medical care. Community oncology practices like this may allow more people to get screening and care they would otherwise avoid, which helps with early detection and treatment.
My journey began when I was on vacation and I found a lump in my left breast and Got back home, went through all the testing, and found out that I did have breast cancer. The level of care that I received was amazing. It was a 10 plus. Dr. Amy Hughes was my oncologist, and she was phenomenal. And knowing how to talk with me, and when I wanted to quit chemo, knowing how to keep me on the path of what I needed to do. Dr. Hamling was my surgeon. He's amazing. He did a great job, just a very caring individual. I just felt my level of care was so good.
When fighting the unimaginable, having access to quality care and cancer care may help improve patients' outcomes and save lives.
As modern medicine and healthcare continues to improve, these improvements will be highlighted here. See you next time. I'm Dennis Quaid.